Okay, the key issue for this woman is fibroids, but
Yeah.
after looking at the thermography report, so I've started working with her last March, and I have put her on big drainage protocol, tonifying liver, kidneys. She's been on the Physica RCCP program, and then because I use an avatar, in testing her, we've been doing a lot of detoxing too, viral, mycoplasma, etc. So we recently just did this, the thermography, because this is pretty new for me. And I'm seeing that it's a fairly chaotic picture. So despite everything that we've done, there's a lot of toxicity, and she's having real issues compensating.
Well, the chaotic nature is seeing in all these different responses in a particular area. So she doesn't have different responses in the back or the lower abdomen or the upper abdomen or even the chest, but she really has different responses in the head and neck. So those are chaotic when some are normal regulation, some are paradox, some are blocked, and some are hyper. And you see these mixtures of colors. So that makes this 10-point in the head and neck and then 9-point in the head and the neck of the chaos or disorder.
Mm-hmm.
Now that means that these are losing their regulation control while everything else is kind of trying to remain healthy, but in so doing it becomes toxic. So that's what the hyperregulation is. And the fibroids are a exteriorization and a side indication of fatty acid metabolism disorders accompanied with endocrine disorders, accompanying by a possible enzyme or liver dysfunction. So always with fibroids, I like to look at liver and pancreas, because if you don't have an adequate enzyme system or detoxification system of processing fatty acids, then the body is going to want to deposit those into these benign growths, right? And so you wonder, okay, we'll go through in a second our order of things, but you look at the right pancreas 1 point, and you see how cold the first point is and that it becomes even colder. So this first point should never be this low. It should be somewhere 1/2 degree or 3/4 of a degree below the baseline or even at the baseline. So this is an enzyme problem, but we'll see that in a second. So this is a fibroid patient, and we first look at the block regulation. We only see 23% in the neck, but we do see 14% in the chest, which is this axillary lymph in the right axilla, blocked lymph. So when I see blocked lymph in axilla, I think of either going up towards the lymph and looking at the lymph and down towards the breast. So I become a little bit concerned about breast health, and I do want to look at that more on the thermogram than if I didn't see anything with the axilla. So also blocked lymph, we see it here, and we also see this paradox in the lymph, which is an inflammation, which is healthy. It's always healthy that the lymph system is reacting to something, because if a person is weak, they won't react anymore. And so it's like having a fever. It's a good thing up to a certain point. And so we like to see that kind of initiation of the person's own immune system, but it's reacting because of something. And so also you notice that there's all these warm points, especially on L5, L6. That L7 and 8 point more towards the problem in the abdomen, and L5, L6 point more towards something in the head, which means dental or head. We see that there is a noticeable asymmetry of the ethmoids and the minimal blocking or a paradox of the lymph, so there is some kind of a viral hint. And these very hot mastoids can be neck or TMJ, but there's some kind of, all these hot points, so the CP and the mastoids indicate there's some kind of inflammation in the brain. I don't know if she's, I don't know, it could be Lyme, it could be something else. Does she have neck problems or
not that we
history
discussed.
infections?
No.
Yep. Okay. So next we want to look for the span, which is huge. She comes all the way down to the bottom of 29 degrees and all the way up to the top of 37.5. So there is some lack of a modulation or a lack of the integrity of the regulation system. How old is she?
53.
And and also with these really hot head points, you want to ask, has there been any head trauma?
We did discuss it. She can't remember anything. There's nothing in particular, because I did already review the report with her, and we discussed cranial issues, if she had had any head trauma, and she couldn't think of anything, but I think it just was resonating with her that there was something going on for the head.
Okay.
She wasn't surprised, put it that way.
And then you can see a side difference in the upper jaw of 0.8 degree. You can kind of see that here. And not much of an overall difference here, but you can see that there are two teeth that are next to each other that have a very big difference. And so we'll be able to see that. But I think this case is related, and we'll see that in a second, to maybe some low-grade infection, something we don't know about in the head region, and these are a little bit peculiar on the dental. I would imagine there's something going on there. The breasts are a 0.8 degree difference, which is something notable. There are two hypo spots in the breast, but no blocked spots. So we're going to look at that. So being the only indication, and this is all she told you, is that she's developing fibroids?
That was her main issue. She's having difficulty sleeping. She noticed that her urine was very frothy. This was when she originally came in. That symptom has cleared up with everything we've had her on. But fibroids are the key thing. She wanted to lose weight too, so we did that. I put her on a program. She was on a paleo diet for a while, and she did lose weight, which she'd been having great difficulty doing. But she felt the fibroids were much more noticeable after the weight loss. In fact, they're bothering her more now. She's still menstruating.
How did she do her weight loss?
First, I put her on the Physica's Restoring Cellular Communication Pathway protocol. We did that with lymphatic drainage for a month, and then we added a paleo diet, which is really just, no dairy, no gluten, vegetables, proteins. She's been on a lot of liver supports as well the whole time.
Okay, so here, remember when I was saying that there were two teeth that had very different temperatures? Mm-hmm. So here is the strongest indication there's something wrong with these teeth in the lower right. And do they relate to what we think could be going on? And remember we saw the pancreas, that cold and fibroids relate to enzyme systems or the liver, and here we see two pancreas teeth. Mm-hmm. So do you know what's happening at this area of her mouth?
Nothing that she feels, but she did go today to have an amalgam removed, and it is in this lower right quadrant.
That's interesting. So I would want a panoramic x-ray, and I would look in this whole lower right quadrant. And then I would give her pancreatic enzymes. Now, she has 6 out of 12 criteria, which is the borderline number on the breast. She has a side difference, which adds to it. She doesn't have a sternum block, which is good because that would add even more, but she has this right axillary lymph block with the right breast being warmer. And the teeth on the right side. Now, these are connected to the stomach. The stomach meridian goes through the breast. So we have the stomach tooth going through the lymph to the axillary region, and then we Here we have the right breast here. So we have very, I would say, the beginnings that could evolve. And if we also look at the overall top summary of her whole body chemistry, she has a severe vulnerability to body tissues to physiologically compensated influence. This, we don't say in the United States, but in Germany they used to call this the tumor terrain, which means that the person has a vulnerability, not that they have a tumor at all, but they're not doing the things that could prevent it. And there's a hint that in 10 years or 20 or 50, they could develop something.
She has been on enzymes since March.
Digestive enzymes?
Yes. She's been on a lot of really good stuff, so that's why I was a little bit surprised when I saw it, but I, acknowledge that after a certain point, it can be, take time to remove the problems in the body.
Well, you also, every company makes an enzyme that may be what that person needs or not, and what I think is very important, just like what I do with probiotics is I alternate between one or two companies,
right?
Every couple of months, so the body doesn't habituate, and it's possible, quality control in our form of medicine is not, great in some companies, and you might have chosen an enzyme that doesn't have enough, chymotrypsin or hydrochloric acid or pancreatic enzymes, or, from animals that are plants that are not really producing enough. So I would switch the remedy. If you treat somebody and then for a problem, and then the problem is not augmented, you either have the wrong area you're treating or the remedies that you're doing are not going to work, and that's why everybody has 3 or 4 or 5 different pancreas remedies or liver remedies. I carry 3 Western herbal, I carry 2 Chinese herbal, and I carry tinctures of 3 or 4 different companies, because the frequency and the level to adjust your therapy differs, and all of us are not perfect in our selections every time.
Yeah.
So this is a very, very, very clear textbook case of a very big concern with the development of future breast cancer. Here we see it here. We see it clearly in the teeth. The teeth are correlated to exact problems, and then we see this physiologically compensated pattern. We see the distant related focal being the teeth. We see the breast side difference, so you know exactly where you need to work to undo this and get her down to a 4 or a 3 out of 12 instead of 6 out of 12. However, I don't believe she has breast cancer now. So, and then you see you want to help the overall immune system, because remember that thymus was blocked, and then you'll want to, maybe there's some structural stuff going on, which is probably the least of the problem. Then you have the bowel dysbiosis, which is very important in the whole lymph system. I mean, our lymph system in our gut is, tremendous. And it's a huge influence. So if the chemistry is off, if there's inflammation or fungus, then we want to change that. So as we come back to the beginning, this breast is an issue, this physiologically vulnerability is an issue, the global immune stress and the dysbiosis, but really you want to write in here dental lower right and get to that right away.